Hi, I'm Dr. Kevin Mailo, one of the co-hosts of the Physician Empowerment Podcast. At Physician Empowerment, we're dedicated to improving the lives of Canadian physicians, personally, professionally, and financially. If you're loving what you're listening to, let us know. We always want to hear your feedback. Connect with us. If you want to go further, we've got outstanding programming, both in person and online. So look us up. But regardless, we hope you really enjoy this episode. Hi, I'm Dr. Kevin Mailo with the Physician Empowerment Podcast, and I am very happy to introduce Dr. Angie Hong to the show. And Dr. Angie Hong is a Toronto-based family physician and obesity medicine practitioner who has, for years now, been involved in the coaching space. And you can find her website at www.angiehongmd.com. And so with that being said, Angie, why don't we start with a little bit about, how do you do, and, tell me a little bit about your practice journey. So, you started in family medicine. How did you move to obesity medicine? And then how did you move into coaching?
Yeah, first of all, thanks for having me. I'm really looking forward to this conversation. So I graduated from U of T a long time ago in 2001, and I had a bread and butter family practice for a bunch of years. But I know I was having babies on and off, so I was doing a lot of locuming and then a small family practice. And then once my youngest got into grade 1, I thought, I have more time on my hands. Oh, I have so much time on my hands now that she's in grade 1. I decided to study obesity medicine because that was really at a time where we were taught nothing about obesity other than maybe calorie control or something like that. And I noticed I was seeing so many patients where I had to have this conversation. So I decided to get board certified in the States, and then put a shingle out as someone who has an expertise in this field. And that's been about 10 years now.
Wow.
Yeah.
Wow. So, and I should pause here before we go any further. I forgot to mention, Angie is joining us at our conference in Toronto, May 25th and 26th of this year. And we'll be doing a workshop in the coaching space. And we'll talk a little bit more about that at the end. But Angie, talk about your journey in coaching. When did you first hear about it? And then how did you sort of begin to take practical steps into this space?
Yeah. So it was an act of serendipity, I think. In my pursuit of being better at helping my patients in obesity medicine, I was taking a ton of courses in psychotherapy. So I had so I can increase my skill in that area. And thus I decided to take a course in solution-focused therapy. And apparently this course is being offered at University of Toronto, and this was pre-pandemic, so it was all in, face-to-face. And when I showed up at the course, I was sitting in a room full of executives and HR people and educators with not a therapist in sight. So I was wondering to myself, like, where the heck am I? And it turned out I signed up for the wrong course. I was in a solution-focused coaching course. I didn't even know there was such a thing. And it was being taught by folks who know the coaching space, know Dr. Hae-Sun Moon, who's a world-famous coaching teacher. And in that weekend, I totally fell in love with coaching. I thought this is an incredible skill set and a way to talk to people. And thus my journey began.
Oh, I love that. I love that. So today's topic is going to be the distinction between coaching and counseling, right? Because I think, to the outside, and I've gone through coaching myself. I thought it was amazing. It's something I want to continue. It's very transformative. But talk to us about that distinction, because I think everybody hears like coaching. It's like, oh, somebody talking to me about self-improvement. Oh, that sounds like therapy or counseling. Talk about the difference for us, because that's what I really want to cover, because I think this is relevant to practicing physicians in our own life for a number of reasons. Number one, I think most of us should be doing some form of coaching or counseling, or both, ideally, in order to navigate the stresses of the job and work-life balance and to be that happy, thriving self. But I also think it's a useful tool. I mean, you started this, you kind of stepped into it by accident with the intent of learning to do some kind of motivational interviewing for your patients or to better engage with your patients, right? So I feel like the skill set is so powerful, not only for us, receiving it, but having some proficiency or even an understanding of it allows us, I think, to be better in our work with our colleagues, patients, and families. But talk to us about that distinction, right? Dispel some of the myths.
Yeah, this is usually the first thing I talk about when I'm engaging in a new call with someone or explaining coaching, is explaining the differences between coaching, mentoring, and therapy. So I'll start with mentoring, because mentoring is, many physicians early in the career and maybe further on are used to that, where it's a vertical relationship where you seek someone who has more experience in a field or more, knowledge in a field, and they give you advice based on that experience and knowledge. So obviously it has its place. It's very useful, especially for people who are entering a new space or need some advising. So vertical relationship. And therapy is also, in a way, a vertical relationship. The therapist has their skill set. They're trying to get you in together to a place that, in a way that is a decided place of better mental health, better functioning. And therapy is also that might go backwards in your life. They'll ask you about your childhood. They'll ask about, what the origin or the reason something is happening, and they'll help you work that out, which of course has its valuable place. And people might come to therapy when they are very unwell, maybe not functioning. So that's where, the value of therapy is. Now, coaching has similarities, but it's very different in that normally people who engage in coaching are not in a place where they're not functioning. They don't come to a coach with, help me with this mental illness. In fact, they are usually in a very good or thriving place, and they're asking for coaching to get to even better. So the start place is a little bit different in coaching. And then coaching is really forward focused. Rarely will a coach ask you, like, what happened in your childhood? That's not the skill set of a coach, and that's more in the therapy territory. So you'll notice, Kevin, I know you've had coaching conversations where it is a conversation. It's more a process of like inquiry. The coach hardly says anything. They just listen and help you connect the dots. And then they ask you questions where you are then going to come up with your own like awarenesses that perhaps weren't obvious to you before, or you are going to come up with, your unrealized resources and strengths. And then together, so coaching as a horizontal relationship, you're co-creating a preferred future. So it's not what the therapist wants for you, what the mentor has in mind for you. You're sort of making that together. Does that make sense?
No, I love it. Yeah, I mean, that was sort of my understanding, is that therapy can be very powerful in helping one explore the past and resolve, kind of pain or difficulties or dysfunctional thinking or action from the past. But I really have enjoyed my coaching sessions because they're very like task and future oriented. And I think for physicians, that can be deeply gratifying for us because we like to get things done. We like to make decisions. And so being able there, at least, speaking from my own experiences, like being able to sort of like go through what's happening now and then what do I want to really achieve brings a lot of focus. And it being action and task oriented, I think is a very powerful element to coaching as far as attaining our goals.
Yeah, and I think that's why, in a way, coaching really started in the corporate world. Go forward, you have these goals, you have to somehow meet these goals. But what I enjoy about coaching is that sometimes the client comes to me with a goal and it doesn't end up being their real goal.
Wow. Yeah. But it's true. It's that self-discovery that comes out of the coaching process.
Or their motivations for why they wanted to reach that goal well, you know your motivations. Why do you need coaching on it? But the truth is that wasn't their real motivations.
Yeah.
So getting further, deeper into their values and true motivations, that's, when you're a coach and you're helping clients get to that, then it's quite enjoyable.
No, that sounds great. And so what do like within your coaching practice, what do folks typically come to you with? And maybe where do you start? And then where do you find yourself at the end of that coaching journey with a client?
Yeah, so all varied things. I mean, because of my background in obesity medicine, some folks might find me that way and they want to talk about weight. And I, may absolutely make the distinction. This is not a medical visit. I'm not going to ask you about anything related to medicine and that sort of thing. So we might start off there and I have one client where we're started off with that and now we're going all over her life, like just talking about relationships and parenting and all the other aspects. And so one of her comments to me was that she enjoyed that it was really whole person coaching and we're not just focusing on the one thing she thought she was coming for.
Wow. Wow, I love that. What about career coaching? What's been your experience doing some career coaching? Because I know that's one that we actually get, fairly often through physician empowerment, and we do coaching in the masterclass.
Mm.
But it's oriented towards finance and wealth creation. And again, it's that distinction of we are not financial planners. We are not, experts in the finance industry. We're there to help you, identify your challenges and your goals, and change behavior to get there. But yeah, there's that handoff of when it's no longer coaching and when it's, either counseling or financial advice, and you don't want to step into those areas. So talk to us though about career, because that's one that we certainly overlap with, and we get a lot of physicians engaging us, in terms of like, career planning, not just as it relates to finance, but kind of, work-life balance, burnout, and really wanting to thrive, because that's the big challenge. Sorry, I'm just going to go one more rant, that I have, and why I'm so passionate about the work we do in physician empowerment, because the challenge is, and this was something I went through myself early on in my career, is if I'm not happy and thriving now in my career, when will that be? And so the challenge is on all of us to be like, life doesn't have to be perfect, and it never will be, and you shouldn't expect that, but it should be good. And we should feel optimistic about our personal, professional, and financial lives. And if not now, then when? So the action has to start now. The change has to start now. So what do you find in terms of career counseling? And I'd like to hear like about non-physician clients as well, right? Because I think we tend to silo within the profession. But talk to us about that experience you've had across different professions and coaching people through finding meaning in their work.
This comes back to what am I coaching? So in coaching parlance, I often say we're coaching the person and not the problem. So if in fact, I just had a discovery call related to career coaching. If you're looking for a menu of possible options and, how much you could make from each option and, who you can contact, you wouldn't be contacting me as a coach for that. You would want a mentor or a career counselor or something like that. But for career or transition or retirement coaching, you really want to, first of all, know what do you want? What are your real hopes and why do you want those things? So it's more of a personal exploration into what will make you feel more gratified and satisfied and why. So there are some people, for instance, that no matter what they do, they're not going to feel happy. They're going to
Wow.
feel dissatisfied no matter what career they're in. And this is part of the coaching to discover things about yourself that perhaps you didn't know. And then once you get through that process, we can talk about what's next, action steps, who you can talk to, and that sort of coaching. But the real meat of the coaching is for you to learn more about yourself.
No, I love that. Talk about burnout a little bit,
Mm.
because it's something that I'm so happy we're beginning to have real discussions within the profession
Yeah.
about
Yeah.
burnout, right? And recognizing that it takes many forms. It's highly, highly prevalent in the profession. You can just look at the data,
Mhm.
the CMA, which I'd encourage everybody to do because it's outstanding. But talk to us about burnout, and what does burnout mean to you from your perspective, having been in this coaching role?
Yeah, in fact, this is where, the quote unquote literature shines in terms of the value of coaching. And, as physicians, we love to see evidence. We love to see
Yes.
evidence. It has to be published somewhere.
Yeah.
So this is actually, if you look in the literature about physician coaching, a lot of it is around burnout. And the evidence shows that coaching is very effective to help with emotional burnout and exhaustion. So why? And they've done different studies with either groups or individual. And I think part of it is, the one of the definitions of the burnout, and there's multiple definitions, is feeling a lack of control. And so one of the things we'll talk about in coaching really is what is within your control. And that's a process of discovery. Like if one thinks nothing is in my control and I'm just working and working and I'm not sure what I'm working for, that's a recipe for burnout and emotional exhaustion. So starting with what's possible, what's within one's control, what does it look like for you when you're less burnt out? And making, those action steps that you talked about to get closer to that. Partly, I think just the ability to talk to someone about it in a really safe, non-judgmental space is likely helpful. We know these peer-to-peer groups have been shown to be helpful, and the peers often have no coaching training whatsoever. It's just being able to share in a non-judgmental and safe space. But I think in terms of physicians and burnouts, I mean, I think that physicians are not reaching out to people enough for burnout and waiting until they're leaving or they're in much more dire straits, unfortunately.
No, I think that's a huge issue within the profession. I mean, we tend to have that grin and bear mindset, which is deeply detrimental because I really think we should be having more open discussions, not just across the profession at sort of an organizational level, but like within our workspaces. And when you do meet with a colleague or you happen to be talking at work, right? Like just it's that recognition and that ability to support one another. And I think individually it starts with making those small understandings that there are always elements within your control that you can have an effect on your work environment and you can find meaning in your work. So talk to us a little bit more pragmatically. What does coaching look like? Or what, okay, I mean this is a podcast for physicians, so what does coaching look like for physicians? And I'm sure
Yeah.
that's a terrible question because it probably looks like different things to different people at different stages of their career and possibly in different specialties. But go ahead and talk to us about like what a journey would be for, a physician seeking coaching in their career.
So great question, big question.
Oh, that's you being generous. That was a terrible question.
How do I answer this question? No, let's start at the beginning of a physician's journey in medical school. So, what's really interesting is there are schools, medical schools in the United States that have longitudinal coaching programs for their learners, which is pretty incredible. And why is this useful? Well, it helps them with a whole range of skill, setting goals, resilience, learning how to take care of oneself, all of those things, which in a way are preventative to burnout. Learning those things and learning oneself and having that self-awareness early on in the career, and even from deciding like what specialty should I go into, having some coaching around that, because I don't know what it was like for you, but really we had no guidance. We just had to observe the rotation. This looked like a good life, I think I'll pick this. We had no coach. We weren't allowed
Oh,
to talk about
yeah,
money.
no, it
Yeah.
was, yeah, it was really something.
Yeah, we just had to kind of guess based on who we worked with. And, we couldn't ask questions that we maybe held deeply. So, medical school, I think, is a great place to start coaching and through residency. So, some of the literature is coaching, showing the benefits of coaching residents. Same thing, they're also learning how to curate their journey through residency. So, they are allowed to be a part of that as well. And then out of residency is, when you're entering your physician life. This is where I'll see some clients. And right now in Canada, there's not a lot of understanding of coaching. So again, if it started earlier, that would be great. But burnout, career transitions, and other personal issues that come up as we get into our work life, and then leadership.
I love it.
So lead is where, HOS organizations might be asking for their physician leaders to undergo coaching, maybe as a benefit of the package of the leadership or as part of a 360 evaluation. And then the last part of the physician journey is when they're thinking of retiring. So retirement coaching, what do I identify as doing this my whole life? This is who I am. Who am I without my job? Or, those kinds of coaching conversations. So, right from the beginning.
No, I think that's really powerful. I'll reflect on that transition into practice because, I've seen this with physicians and watched it, but, you go through all those years of sacrifice, getting into medical school, getting through medical school, going through, residency and fellowship training, and you enter practice, you're working hard, you're working fast, you feel that confidence about your skill set and who you are. And, the work is still very, very exciting. But then sometime in that first 5, maybe up to 10 years, you realize that parts of medicine are a job, right? Parts of medicine have undesirable or repetitive or redundant elements. One of the big ones that I hear about over and over again is the administrative load that doctors are expected to face, right? Like, especially family physicians, the paperwork, the referrals, a lot of these issues. And so it begins to really hit you that this is it, right? Like, there is always going to be this element to medicine that isn't as fun or exciting as you want it to be. And so how do you talk to physicians about navigating those issues, right? And even just that loss of like newness, if you want to describe it as that, where you are the latest and greatest, you got the most advanced surgical fellowship training, but now, a few years into it, there are other newer faces and, you're maybe slower or not as bold or whatever it is. How do you talk to or guide physicians through that transition of accepting practice and even accepting being on the normal part of the bell curve, that you're not that most physicians, we are all on a bell curve, are not exceptional necessarily relative to each other, right? There are always exceptional physicians, but most of us are practiced pretty normatively, and that's even more so now that we have more data in practice, right? So we're now driven by data, not just our own self-perception. So talk about that, because I think that's a powerful starting point for physicians who are in practice to begin thinking about burnout and their connection to the meaning in their jobs.
Well, I mean, this again speaks to why it's so important and would have been so useful if there was some coaching earlier in a physician's career. So they were able to and had that conversation and were thinking of themselves, not just as a physician, but their whole and their values. And what are the values that you want to meet at work versus the rest of your life? And kind of honing in on that and getting the nuances of that. Because for some, physicians in that stage, it might mean, I think I need to transition and do something else. And it could mean that based on understanding your values and why you're making money and what are you going to do with all that money and what are you going to do with all that time that you're looking for, all of that. And then some people would actually maybe have a new appreciation or see what they're currently doing differently. And I'm kind of going through that process myself as I am in family medicine in Ontario. Well, Canada is having a problem with family medicine, but Ontario is. And I'm actually in a process of increasing my family practice while everyone is leaving.
Oh, wow.
So, right, that was based on a lot of coaching that I had based on, what I want to get from a job.
Wow. That's
Yeah.
outstanding.
Yeah, and have those conversations about your values and meaning and what are you going to do with all that stuff that you're trying to amass?
And I think as well, the other big reflection is, and we should be wrapping up. And I think I could go on and keep asking you terrible questions that are unanswerable.
They're fantastic questions.
But the big one, that really strikes me as well is that our careers are not static, right? And you highlighted it so well, Angie, is that there is always a flux, right? And we're not talking about like having a job and then changing positions or getting a promotion or expanding or narrowing your scope of practice. I mean, it's like, well, you're having kids.
Mm-hmm.
What does your life look like now, right? Or you're planning for retirement, and there's going to come a day when you look in the mirror and you don't see a practicing physician, when that's been either your aspiration or your reality for your entire adult life. And so again, it's this idea that we are always changing. We are always, hopefully growing. And so I feel like coaching can be key in developing some insight around that.
I love that sentiment, because I recently had a conversation with someone new out in practice, and they're youngish. They're only a couple of years out in practice, and was worried that the decision they were going to make, how could they live with that decision for the next 30 years? And I wanted to share that. Look at many physicians. We are actually in a really incredible profession where we can shape shift throughout our careers. We can make many transitions within our career. And so thinking about the next 30 years when you're just in starting practice may not be that fruitful a conversation.
All right. Of course, we went on and on. And like I said, I could just keep going, but we are very, very excited to have you come and join us at the conference this May, because I think this is so important, right? The conference is, oriented towards finance, but fundamentally, this is a physician empowerment thing that we rant on and on about, but it's the idea of you as the most important investment. That money actually means very little in your life if you are not thriving personally and professionally. And I really like to think of coaching as a key component to that.
Yeah.
And I don't know that it has to be something, we all do longitudinally throughout, every year of our career, but I think certainly for these points where we're either struggling to find meaning in our jobs, navigating a transition in our practice, career, or personal life that might impact our job satisfaction, I think is key, are key considerations. So with that being said, again, we are so glad to have had you on the show, and we look forward to getting you back again. Let me know if you have any final thoughts before we wrap up.
No, I've really enjoyed this conversation. I'm really looking forward to the workshop in May, and thank you for inviting us.
Thank you so much, Angie. Thank you so much for listening to the Physician Empowerment Podcast. If you're ready to take those next steps in transforming your practice, finances, or personal well-being, then come and join us at physempowerment.ca, PHYS empowerment.ca, to learn more about how we can help. If today's episode resonated with you, I'd really appreciate it if you would share our podcast with a colleague or friend, and head over to Apple Podcasts to give us a 5-star rating and review. If you've got feedback, questions, or suggestions for future episode topics, we'd love to hear from you. If you want to join us and be interviewed and share some of your story, we'd absolutely love that as well. Please send me an email at kmilo@physempowerment.ca. Thank you again for listening.